Hi, this video is the demonstration of the of the hair transplant on this client. I had to fix this hairline, but the other important thing, if you look beyond and see, there's a lot of bumps here, and there's cobblestoning because they put a lot of thick graft. So number one is there's a lot of things wrong. Number one, you can see a lot of bumps. Number two, the hairline is a straight circle, and we never born with a straight circle hairline. So when you wear your hair out, it's gonna look very, very abnormal, and it will draw attention right away to that. Number three is poor density, and so it doesn't look great. So then they are cheaper, but then again, this is your face. You know, you're gonna be wearing this for the rest of your life, and you want to make sure you get it done right in the first time, because you know, going with a cheap price and then having no density, and you have and gotta come to me to fix it, it's gonna cost you a lot more in the long run. And other clinics, it would take 2, 3, or 4 surgery to get one surgery with my work with the full density. So with my work, most of the time, can't guarantee 100% of the time you will get the density you get done with one surgery. But what separates my work is not just about the density, it's the artistry of the hairline. Because you want to look so natural that no one knows you have had surgery. I'd rather work on a plain canvas than having to repair, because to repair is so difficult. So in order to repair, we build a hairline in front of the plugs, number one. Number two, if it get really bad, then we might have to FUE some of the plugs, so it would thin it out and look less harsh. Number three, there's wave and zigzag to it, and I mentioned quite a bit of zigzag according to many of my video, but no hairlines turn out straight. So we will transplant through them to give the density. We will go in front of the circle hairline to give you a more natural hairline, and then to hide the plugs as well, not just to hide the circular hairline, but to hide the plugs. And the plugs get really bad, then I'm just gonna thin out some of the plugs. But and again, there's two things you don't want to base on: location. You don't want to go to someone just close to you because it's convenient. And not every surgeon are specialized on African curly hair. Especially with woman curly hair, it's a lot, especially African American woman hairline is the most complicated. Woman hairline is complicated in general, so you want a lot of detail involved. It's not a straight circle. And then the other thing is the surgeon and the clinic had to really specialize on African curly hair. So you don't base on location, and you don't base on cheap price. Again, those can get you really bad result, and then I have to fix it. And I'll tell you honestly, at least once a week or once every other week, I have to fix other people's work who are not specialized in African curly hair. So this is one example of it. A lot of plugs.